On a November evening in 2025, at 7:12 in the evening, I was sitting alone in a 2014 Toyota Camry in the parking lot of an office park in Willoughby, Ohio, that did not belong to my employer anymore. The building was dark except for one stairwell light on the third floor that nobody had turned off. On the passenger seat next to me was a sealed envelope from a law firm on Huron Road in downtown Cleveland, with the firm's name printed on cream paper and my own name typed under it. Inside the envelope was a piece of paper that said my share of a federal False Claims Act settlement, after withholdings and after attorney fees, was $55,294,000 and change. It had taken 22 months under seal, 407 patient charts, one printed consulting playbook I had kept in my trunk between an old Ohio road map and a spare tire, and one fabricated diagnosis on my own mother's medical record to get to that number. I am going to tell you how it happened. I am going to tell you the names, because the names are public now, and the names matter. My name is Doreen Walsh. I am 57 years old. I am a senior medical coding auditor. I was the only child of a hospice physician, and I was the person who counted. My father, Edward Walsh, was a hospice doctor in Cleveland for 31 years. He did his internal medicine residency at Metropolitan General in 1972, then moved into hospice care in 1979, when hospice was still an unusual choice for a physician to make. He worked at 3 different programs over his career, and he ran the last one, a small hospice house on the east side of Cleveland, for the final 11 years of his working life. He died on a Tuesday in October of 2010 of pancreatic cancer in a room at Cleveland Clinic that he had walked past every morning for most of his working life. He died in the same building where he had pronounced perhaps 400 of his own patients over 3 decades. He was 68 years old. He was diagnosed in February of 2010, and he lasted through October, which was longer than his own prognosis. He was the one who taught me how to read a chart. He used to say, and he said this many times, that the chart is the patient's biography and that you guard it. He did not mean that as a metaphor. He meant it the way an archivist means it. He meant that the chart is the only written record of a person's body, and that a body is most of what a person is by the time they are old, and that if you do not tell the truth on the chart, then you have erased the person. In the last year of his life, when he had stopped practicing but was still lucid, he asked me to sit with him at the kitchen table one Sunday afternoon, and he took me through his own chart from his own hospital admission, line by line, showing me where the attending had gotten it right, and where the attending had written a note that was technically true, but pastorally wrong, which was a distinction he made often. He said that was the only way I would really understand what I did for a living, which at that time had been 7 years of medical coding auditing at Heartland, and he was right. I understood differently after that Sunday. I understood that he was handing me a practice, not a job. I started working in medical coding in 2003. I have been doing it for 22 years. I took the job because I wanted to be near what my father did for a living, and I was not going to medical school at 36, and coding was the closest I could get. For most of those 22 years, I worked for a company called Heartland Integrated Health Plans. Heartland is the 3rd largest Medicare Advantage insurer in the upper Midwest. We covered about 420,000 lives across Ohio, Pennsylvania, and the eastern half of Indiana. Most of our enrollees were over 65. Most of them were retired steelworkers, retired school teachers, retired nurses, and small business owners whose spouses had died before them. I was a senior auditor on the 5th floor of the Heartland Tower on Ontario Street in downtown Cleveland. My desk was 3 desks from the window. I could see the lake in winter when the trees were bare. Before I tell you what happened, I want to explain one thing about how the business works, because you cannot understand this story without understanding it, and the people who ran this scheme counted on you not understanding it. When the federal government pays a Medicare Advantage insurer like Heartland for an older American's coverage, it does not pay a flat amount. It pays what is called a risk-adjusted rate. The sicker the patient, the more the insurer receives. This sounds reasonable, and in the abstract, it is reasonable. The logic is that a Medicare Advantage plan that covers a person with diabetes and heart failure and kidney disease spends more on that person than a plan that covers a healthy retiree, so the federal government pays the plan more to cover that sicker person. The mechanism that translates diagnoses into money is something called the Hierarchical Condition Category System, or HCC. Each HCC has a numeric score called a risk adjustment factor, or RAF. A diabetes diagnosis without complications gives the patient a RAF uplift of about 0.105. That translates into roughly $1,100 additional federal dollars per year on that patient's plan. A diabetes diagnosis with complications, which is a different HCC code, gives a RAF uplift of about 0.318. That translates into roughly $3,200 federal dollars per patient per year. A diagnosis of congestive heart failure, HCC 85, gives a RAF uplift of about 0.368, or about $3,800 federal dollars per year on that patient. Every single year, every Medicare Advantage insurer submits a file to the Centers for Medicare and Medicaid Services, a quarterly submission called Risk Adjustment Data Submission, and that file tells CMS what conditions the insurer's members have. CMS then pays the insurer accordingly. If you can prove, when CMS audits you, that the chart supports the code, the payment is locked in. I am telling you this because the fraud is not complicated once you understand the payment math. The fraud is that you put an HCC code on a patient who does not have that condition or whose chart does not support it, and you do so in the 2 weeks before the quarterly submission window, and you let the money flow. 400 fabricated diagnoses over 18 months at an average uplift of about $3,500 per patient per year comes to roughly $1.4 million in annual federal overbilling on just the 400 I caught. The scheme was much larger than 400. My 400 were a sample, but my 400 were documented, time-stamped, and cross-referenced, and that was all that mattered. I want to tell you about a Thursday evening in January of 2024, because that is the day this story really begins for me. I stayed late at my desk because I was running a pattern audit. Pattern audits were my specialty. Most of our auditors worked case queues, meaning they reviewed specific charts one at a time. I looked for patterns, which meant I would pull samples of charts across a time window and look for anomalies in the coding distribution. That evening, I was pulling a random sample of Medicare Advantage charts from the previous quarter, from our Cleveland regional pool, and scanning for HCC codes that had been added late in the submission window. It was procedural work. I did it 4 evenings a quarter. I liked the quiet of the office after 6 o'clock. I liked that the lights dimmed automatically at 6:30. I liked having the entire 5th floor to myself. On that particular Thursday, the 147th record in my random sample was a chart for an 83-year-old woman who lived in Strongsville, Ohio, and who had an HCC 85 diagnosis, congestive heart failure, added to her chart 11 days before the last risk adjustment data submission window. I opened the chart notes. There was no clinical documentation of congestive heart failure anywhere in the chart. There was no echocardiogram. There was no BNP lab. There was no prescribed diuretic. There was no cardiology consult. There was only a code, added by a member of the chart review partnership cell on the 11th floor. I looked at the patient's name. Iris Walsh. My mother. My mother, Iris Walsh, was born in 1941 in Lorain, Ohio. She was a high school librarian for 37 years. She read 3 novels a week for most of her adult life, and she kept a handwritten list of every book she had finished since 1962 in a series of small spiral notebooks that lived on the shelf above her bed. She outlived my father by 13 years, which she and I had both expected. What neither of us had expected was the way the dementia would come on, which was quietly, in the form of her putting the milk in the pantry cabinet in 2021, and then forgetting the name of the street she had lived on since 1978 in the summer of 2022, and then not recognizing the daughter of a lifelong friend at a funeral in early 2023. By the fall of 2023, she was leaving the stove on overnight, and I moved her into Cedar Point. She has lived at Cedar Point Senior Living in Strongsville since November of 2023. She has early-stage vascular dementia, Her insurance is a Heartland Gold Medicare Advantage plan, because when I enrolled her, I used my own employer's plan for continuity of care, because her doctors were in the Heartland network. She does not have congestive heart failure. She has never had congestive heart failure. I am her daughter, and I have been her medical proxy for 5 years, and I have sat in every cardiology consult she has ever had, which is 0, because there has never been any reason for her to see a cardiologist. Someone at Heartland, a person whose name was logged in the chart's audit trail as a member of our chart review partnership cell, had added a $3,800 per year federal diagnosis to my mother's chart, 11 days before a quarterly submission. I took a photograph of the screen with my phone. I closed the chart. I closed my laptop. I went to my car. I drove to Cedar Point. My mother was asleep. I sat beside her until 10:30. Then I drove home to my house on Lee Road in Cleveland Heights, and I opened the storage cabinet in the basement, and I took out a cardboard box of my father's old notebooks, and I found the blue composition notebook he had used in the winter of 2008, and on the first blank page, in the same blue ballpoint pen he used to use, I wrote a single line. Patient, I.D., redacted. Iris Walsh, age 83, HCC 85. Added, January 19th, 2024, 0 clinical basis. Underneath, I wrote the date. Underneath that, I wrote one more line in his handwriting. Not mine, because I had copied his handwriting as a girl and could still do it from memory. The chart is the patient's biography. I closed the notebook. I did not go to bed. I made coffee. I started. For the next 18 months, I did 2 things. During my work hours, I was a senior auditor at Heartland Integrated Health Plans, and I did my job well and without complaint. I continued to receive my quarterly coding bonus, which came to about $7,800 per quarter, about $31,400 over the period I am describing, paid by check as a supplement to my salary, because Heartland paid its auditors a performance share tied to total plan revenue uplift. I did not cash any of those checks. I signed them, endorsed them with my name on the back, and placed them in a manila envelope in the second drawer of my kitchen, beneath the silverware tray, and I kept them there. I kept them there because I did not know what I was going to do, and I did not want to spend a single dollar that had come from the thing I was now investigating. Outside my work hours, in the evenings and on weekends, I sat at my kitchen table with my father's blue composition notebook and a second blue notebook I had bought at a Walgreens on Mayfield Road, and I quietly, deliberately, methodically built a file. Each quarter, I pulled a random sample of 40 charts from the Medicare Advantage pool, using the same audit methodology I was paid to use for Heartland, and for each chart, I compared the coded HCC diagnoses against the clinical documentation. I was looking for a specific pattern. HCC code added in the final 2 weeks before a submission window, no clinical basis in the chart, added by someone tagged in the audit trail as a member of the chart review partnership cell on the 11th floor. I found them every quarter. The lowest quarter gave me 31 hits out of 40. The highest gave me 37. Over 10 quarters of work, I accumulated 407 documented anomalies. Every one of them was in a standardized format. Every one of them had a timestamp. Every one of them was cross-referenced to the CMS submission date. Every one of them had a diagnosis code, a clinical note summary, a quantified gap between the two, and a line identifying which chart review partnership cell member had entered the code. 2 names showed up on 80% of the anomalies. The first was a coding analyst named Brittany Lonergan, who had joined Heartland 8 months earlier. The second was a coding analyst named Ian Peregrine Moss, who had joined 3 months before that. Both of them reported to a man named Reed Halverson. Reed Halverson was the director of risk coding at Heartland. He had joined the company in 2021. He was 36 years old. He was not a clinician. He had an MBA from Case Western Reserve University and a certified risk coder credential he had earned in a single summer through an online program that involved 12 hours of continuing education and a proctored multiple-choice examination. Before Heartland, he He had worked for 4 years at a healthcare consulting firm in Cleveland, doing what he described on his LinkedIn as revenue cycle optimization. He was pleasant to everyone. He remembered names. He wore gray cashmere turtlenecks in winter and unstructured navy blazers in spring, with slip-on leather shoes from a brand I did not recognize. He walked through the open floor every morning and said good morning to each auditor by name. He did not stop at my desk. He had a way of acknowledging me with a small nod and continuing past. His handshake was firm and warm, in the way of a man who had taken a course on handshakes. He spoke in a managed vocabulary of what I will call compliance English. He did not say fraud. He did not say upcoding. He did not say money. He said partnership methodology, and revenue-adjacent coding latitude, and chart-to-code proximity thresholds, and engagement cadence. I am not editorializing. Those are his phrases. I heard him say each of them in meetings, and I have them written down in the notebook. In January of 2025, Heartland held its annual compliance offsite at a conference center in Westlake, Ohio, a 30-minute drive west of downtown Cleveland. 90 people attended. The morning was the usual stack of regulatory slides. Then, Reed Halverson stood up at the lectern and announced, with the enthusiasm of a man introducing a business partner at a board meeting, that Heartland had formalized what he called an Enterprise Chart Review Excellence Partnership with an Atlanta-based consulting firm called Velvin Atlas Healthcare Advisory. He introduced the firm's engagement partner, a woman named Josephine McAllister, who preferred to be called Jo. Jo McAllister was 47 years old, blonde hair tied back with a black silk ribbon, a dark blue blazer, a white blouse with a small silver pin at the collar in the shape of a cursive letter V. She had an MBA from Harvard Business School. She said, "My program," when she mentioned it, twice in her first 10 minutes. She had spent 12 years at Deloitte in their healthcare practice before moving to Velvin Atlas 6 years ago. She was a fluent, warm, educated speaker. She was reassuring in a specific way. At the end of her keynote, her team walked through the 90-person room and placed a printed document on the table in front of each attendee. The document was 38 pages. It was spiral-bound with a clear plastic cover. The title page read, "Quarterly Coding Playbook, Internal Partner Reference, Do Not Redistribute." On the title page, in small print, was her name, the date, and the phrase, "Property of Velvin Atlas Healthcare Advisory. Return to engagement lead upon departure from premises." The return to engagement lead upon departure from premises instruction was in 12-point bold italic. They did not collect all the copies. I kept mine. I sat in my Camry in the parking lot of the Westlake Conference Center with the engine off and the heater off for the full 40 minutes it took me to read it once, cover to cover. Then I read it a second time and made small marginal notes in pencil in the inside back cover, not on the pages themselves, because I did not yet know what I was doing and I wanted plausible deniability if someone asked to see my copy. Page 11 said this: Revenue Adjacent Coding Latitude. In applying HCC candidate codes to member charts during the quarterly review window, the analyst may annotate any HCC candidate that the partnering clinician could reasonably document within RADV tolerable variance. Page 17 said this: Timing the submission window. Optimization workflow should concentrate attention on the 2-week pre-submission period, where analyst leverage is highest and clinical team availability is at its seasonal peak. Page 23 said this: Chart note to code proximity thresholds. A proximity score of 87% or higher shall be treated as the operational floor for retention in the submitted file. Page 31 said this: Member notification procedures. Members whose charts have been enriched through the chart review partnership shall not be proactively notified, as such notifications may inadvertently introduce clinical ambiguity that delays processing. Enriched. That was the word. I sat in my car in the parking lot of the Westlake Conference Center for 20 minutes, reading and rereading, and then I put the document in the trunk of the Camry, between an old laminated map of Ohio and the spare tire, and I drove home. I put a separate copy in a plastic sleeve in the box of my father's notebooks in the basement. I did not tell anyone what I had read. I did not email anyone. I did not call anyone. I went to bed at 10:30, as I usually did. 10 weeks after the offsite, on a Saturday morning in March of 2025, at 6:14 in the morning, I received an email from the Chief Compliance Officer, whose name was Kevin Brody. Kevin was 52, a longtime Heartland employee, pleasant, not someone I had ever had a problem with. The email was sent to me, to Reed Halverson as copy recipient, and to a distribution list called Compliance Leadership. The subject line said, "Exciting new role, Pattern Review Curriculum." The body of the email said, and I am going to read it to you the way it was written, "Doreen, good morning, and congratulations! Your unparalleled depth as a pattern reviewer has earned the recognition of compliance leadership, and we are excited to announce your new role as lead curriculum developer for the Pattern Review onboarding program. Effective Monday morning, your live chart review credentials will transition to your new team, and you will lead a cohort of 5 exceptional junior auditors in building our next-generation pattern review capability. This is an investment in our people, and specifically in you, and we are thrilled to have you take the lead in this critical area. Please see Reed at 9 a.m. Monday for office assignment and cohort introduction. Warmly, Kevin Brody, CCO." I read the email twice. I understood what it meant. I understood that my live access would be revoked at close of business Friday, which had already happened because the email had been sent at 6:14 Saturday morning. I understood that I would be assigned to a windowless training room on the 9th floor. I understood that I would have 5 junior auditors reporting to me, and that I would spend my days teaching the methodology that Reed Halverson had personally invested in through Velvin Atlas. I understood that I was 38 months from full pension vesting, and that this was the mechanism of my removal, not my firing. I did not reply to the email. I drove to Cedar Point. My mother was in the dining hall eating oatmeal. She looked at me and smiled and said, "Hello, Helen," because on Saturday mornings she often called me Helen, which was her cousin's name, and her cousin had died in 2017. I sat with her and read aloud from the cooking section of the Plain Dealer. We looked at a picture of a rack of lamb. She said she liked the rosemary. I stayed until after lunch. On Monday morning, I was at my desk at 8:30. I had come in at my normal time because I did not want to appear to be reacting to the email. I had already thought through the logic of the email over the weekend, and the logic of my response was to act exactly as I had always acted. I greeted Marco da Silva at the coffee station. I asked Angeli Krishnan how her daughter's piano recital had gone, which was something I always asked on Monday mornings after a weekend I had not seen her. I sat at my desk. I opened my laptop. The login was rejected. The system screen said my credentials had been transitioned and that I should see building services. I closed the laptop. I waited. At 8:45, a building services person came to my desk with a cardboard box and told me my new office was on 9. I put my 2 framed photographs, the one of my parents in front of Cleveland Clinic in 1994 and the one of my mother on her 80th birthday in 2022, into the box. I put a small succulent that had been on my desk for 4 years into the box. I walked to the elevator. 9 was exactly what I expected. A beige room with no windows, a long table, 5 chairs on one side, 1 chair at the head, 5 junior auditors waiting. A set of slides projected on a whiteboard screen. The slides had the Velvin Atlas logo on the bottom right corner. I introduced myself and asked each of them to introduce themselves. Their names were Tara Elkin, Jordan Mafume, Leslie Wattenberg, Sam O'Driscoll, and Priya Karnataka. They were between 26 and 31 years old. They had all joined Heartland within the last 14 months. They were all credentialed in risk coding. They were all pleasant and attentive. On the first day, I did not walk through the slides. I told them that we were going to spend an hour on the difference between a diagnosis and a code. I told them that a diagnosis is a clinical judgment made by a physician who has examined a patient. A code is a number that gets entered into a data submission file. A diagnosis supports a code. A code does not support a diagnosis. I told them that any auditor worth the title works backward from the code to the chart note to the clinical reality, and if there is a gap between any of those 3, the auditor flags it. I did not mention the Velvin Atlas Playbook by name. I did not mention Reed Halverson by name. I simply taught what my father had taught me, which was that the chart is the patient's biography and that you guard it. I had a small digital recorder in my front pocket. I recorded every session. I had not been told I could not record. Nobody had asked me if I was recording. I kept the recordings on an encrypted USB drive that lived in the same manila envelope in the second drawer of my kitchen, where I was keeping the uncashed bonus checks. For the next 4 months, this was my life. Monday through Friday, I taught the cohort. I worked in the windowless room. I had no access to live charts. I no longer received the detailed quarterly risk adjustment data submission files. I no longer had a seat at the compliance leadership meetings. On Saturday mornings, I went to Cedar Point and sat with my mother and read the paper aloud. On Sunday afternoons, I sat at my kitchen table with the blue composition notebook and continued to add entries. I could no longer pull fresh samples from Heartland systems, but I had been quietly archiving, over the previous 18 months, the raw data from my work laptop to a personal external drive using my own authorized audit credentials, and I had 407 documented cases already in hand. I began typing each case into a structured database on the external drive. I cross-referenced each case to the corresponding quarterly CMS submission date. I printed out the CMS public use files for each submission window and highlighted the aggregate figures. I cross-referenced Brittany Lonergan and Ian Peregrine Moss against the coding records. I laid out, in a single spreadsheet with 40 columns, the full mechanism of what had been done. In late May, I realized I needed one more thing. I needed a second voice. Someone who had worked with Velvin Atlas from the inside. Someone who had left for reasons of their own. Someone who could testify to the methodology from the other side of the table. I found her on a Tuesday evening through a LinkedIn search and a conference presentation archive. Her name was Linnea Torvaldsen. She was 61 years old. She was Finnish-American on her father's side and Norwegian-American on her mother's side, which I learned later mattered to her. She had worked at Velvin Atlas Healthcare Advisory from 2018 through 2023, most recently as a senior analyst on the chart review partnership side. She had left in the summer of 2023, and her LinkedIn profile said, in her own language, that she had departed over an irreconcilable dispute with engagement methodology. She now taught 2 evening classes at Akron Community College in the Allied Health program on medical coding ethics and medical records management. She had also, 2 years before leaving Velvin Atlas, given a conference presentation at a regional compliance meeting in Indianapolis on the phrase chart review integrity, and the slides from that presentation were still archived on the conference website. I read them twice. They were the exact opposite of the Velvin Atlas playbook. She was, as far as I could tell, the real thing. I drove to Akron on a Thursday evening in early June. We met at a small coffee shop on West Market Street, about 3 blocks from the community college. The shop was half empty. She was sitting at a corner table when I arrived, reading a paperback. She was smaller than I expected. She wore a charcoal cardigan and reading glasses. I had brought the blue composition notebook, the Velvin Atlas playbook in its plastic sleeve, a thumb drive with my database, and a small recorder that I showed her and asked her permission to use. She said yes, and we turned it on. I explained who I was, what I had been doing, and what I believed the pattern was. I did not tell her the relator share math. I did not tell her I was planning to file. I told her what I had found and asked her what she could add. She listened without interrupting for 19 minutes. When I was done, she reached into a canvas shoulder bag on the chair next to her and pulled out a plain manila folder. Inside the folder were 2 pieces of paper. They were quarterly reconciliation memos, signed by Joe McAllister, from the first quarter of 2022 and the third quarter of 2022. Both memos described the engagement methodology at a named regional insurer that was not Heartland, with specific reference to HCC candidate enrichment targets and submission window optimization. Both memos used the word enrichment in the same clinical application that appeared on page 31 of the playbook I had kept. Both memos had Joe McAllister's handwritten initials at the bottom left corner, and in the case of the Q3 2022 memo, a handwritten note that said, JMCA, verbal agreement with CFO Friday, will document on Monday. The CFO in question, a different regional insurer, had subsequently been named in a 2023 HHS inquiry that did not result in federal action because the documentation at that time was insufficient. She slid the folder across the table. She said, "I walked because I could not sign what they wanted me to sign. I have everything. I will testify." She said it quietly. She meant it. I thanked her. I bought her a second cup of coffee. I told her I would be in touch. I drove back to Cleveland Heights and put the folder in the box in the basement, beside my father's notebook. The next week, I contacted an attorney. His name is Marshall Elkhorn. He is 59 years old. He was an assistant United States attorney in the Northern District of Ohio from 2001 through 2015, handling healthcare fraud and False Claims Act qui tam cases. He went into private practice in 2015 in a small firm on Huron Road in downtown Cleveland, and he has continued to represent qui tam relators exclusively. He took my call on a Tuesday afternoon and told me to come in on Friday at 2 p.m. and to bring everything. I brought everything. The blue composition notebook, my father's older notebook with his handwriting on the first page, the Velvin Atlas Playbook, the Linnea Torvaldsen folder, the thumb drive with my 407 case database, the printed CMS public use files, the cohort session recordings, the manila envelope with the uncashed bonus checks, and a one-page narrative I had typed describing the sequence of events in plain English. I sat across from him at a wood-topped desk in an office with a view of Lake Erie. He read for an hour and 15 minutes without speaking. When he was done, he took off his reading glasses, put them on the desk, and said 4 sentences. "This is the cleanest qui tam file I have seen in 15 years. We file under seal next week. You cannot tell anyone, including your mother, even if she appears to understand, and including any coworker you trust. From this moment forward, I am your only legal contact, and everything you want to say about this case, you say to me." I nodded. I understood what he meant. I went home. On the following Wednesday, Marshall Elkhorn filed a complaint under seal in the Northern District of Ohio, naming Heartland Integrated Health Plans, Velvin Atlas Healthcare Advisory, Reed Halverson in his individual capacity as Director of Risk Coding, and Josephine McAllister in her individual capacity as engagement partner at Velvin Atlas. The complaint alleged violations of the False Claims Act, Title 31 of the United States Code, Sections 3729 through 3733. The seal was for 60 days, to be extended at the discretion of the court. The government, by statute, had 60 days to decide whether to intervene. The extension of the seal, in cases as complex as this one, is routine. The seal on our case was extended 17 times over a period of 22 months. I want to tell you what 22 months under seal actually felt like, because it is different from what people assume, and it is part of the real story. Every day I woke up at 6. I made coffee. I drove to the Heartland building on Ontario Street. I took the elevator to 9. I taught the cohort. I went to lunch alone or with Tara Elkin, who became, over those months, something like a protege because she was the youngest member of the cohort and the one who listened most carefully. Tara was 26. She had gone to Kent State. She was saving to buy her first house. She asked me good questions. I taught her well. I did not tell her anything about the case. On the way home, I stopped at Cedar Point 3 evenings a week and sat with my mother. My mother's dementia was advancing slowly. In March of 2024, she had still recognized me. In June of 2024, she began calling me Helen on some days. By December of 2024, she called me Helen most days. By March of 2025, she began not speaking when I arrived, just reaching out her hand. I would sit with her and hold her hand and read the paper aloud. We read about the weather. We read about the cooking section. We did not read the news. She did not want the news, or she wanted it and could not follow it. I could not tell which. In October of 2024, on the 14th anniversary of my father's death, I lit one candle on the kitchen shelf. It was a plain, white votive candle from the grocery store. I did not tell my mother. She would not have understood. I stood in the kitchen for 20 minutes watching the candle burn. I did not cry. I did not pray. I thought about what he had taught me. I thought about the Sunday afternoon when he had taken me through his own chart at the kitchen table. I thought about his handwriting in the blue composition notebook in the basement, the one I was now filling with my own entries. I thought about the first patient I could remember him talking about when I was a child, an old man named Mr. Kowalczyk, who had been a steelworker and who wanted, at the end, to be read the sports page rather than the Bible, and my father had read him the sports page for 11 consecutive afternoons in the winter of 1987. I understood, standing in my kitchen in 2024, that I had been reading my mother the weather section for exactly the reason my father had read Mr. Kowalczyk the sports page. It was the same practice. It was the practice he had been handing down to me on purpose all those years when I had not known he was handing it down. The candle burned out at 11:52. I went to bed. In November of 2024, my coworker Anjali Krishnan, whom I had mentored for 6 years, called me at home on the Sunday evening before Thanksgiving. She had drunk 1 glass of wine with her husband's family and was worried about me. She said, "Doreen, are you okay? We haven't heard from you much." I said, "I'm fine, I'm teaching." I said, "Happy Thanksgiving, tell your mother I said hello." I hung up. I sat at the kitchen table for 45 minutes without moving. I had not broken the seal. I had not said anything. But that was the closest I had come in 11 months to saying something, and it had taken everything in me to say nothing. I understood in that moment that the 22 months under seal was not a dead zone. It was a slow corrosion. It was a daily practice of not speaking, not correcting the record, not responding to good faith questions from people I cared about, not calling my oldest friend, not explaining why I had become so quiet, not allowing myself a single drink at a holiday meal because I did not trust my own tongue. It was a form of self-erasure in order to preserve evidentiary integrity. It was also, I realized at some point in that second year, the same discipline my mother had practiced when she took care of my father in his last 5 months. You do not speak because the speaking does not serve. You stay. You hold the hand. You read aloud. You wait. I met with Marshal Elkhorn once every 6 weeks for the duration of the seal. I met with a DOJ Civil Division trial attorney named Vivian Bell Rue 3 times during that period, twice in Cleveland and once in Washington. Vivian was 42. She had graduated from Georgetown Law, clerked for a Fourth Circuit judge, and spent 9 years at Maine Justice. She was focused and unsentimental. She asked me procedural questions. She did not make small talk. She was the first person outside Marshall's office who had read my 407 case database in its entirety. She was the second person, after Marshall, to read the Velvin Atlas Playbook. She told me in our second meeting that the case was strong, that DOJ was moving, that HHSOIG was investigating in parallel, and that the FBI Cleveland field office had opened a wire fraud component. She did not tell me the timing. She was careful. I appreciated that. In August of 2025, DOJ intervened. On a Tuesday morning in August of 2025, at 6 a.m. Eastern, federal search warrants were executed simultaneously at 3 locations. The first was Heartland Integrated Health Plan's corporate headquarters on Ontario Street in downtown Cleveland. The 11th floor, where the engagement room was located and where the chart review partnership cell worked, was the primary target. FBI agents and HHSOIG investigators arrived at 6 a.m. and worked through the day. The engagement room was sealed. Every device on the 11th floor was imaged. Every printed document was bagged. The second location was the Velvin Atlas Healthcare Advisory Office in Atlanta, where parallel federal agents executed an identical warrant. The third was Reed Halverson's residence in Shaker Heights, where federal agents arrived at 6:15 a.m. Joe McAllister's residence in Atlanta was served a subpoena rather than a warrant, and her legal team declined to comment. WKYC News ran a brief morning segment at 7:30 a.m. The Plain Dealer published a noon update online. Heartland's CEO, a man named Ramiro Chen Ostro, who had held the position for 4 years, announced his resignation on Friday afternoon for, in his words, personal reasons. He was replaced by an interim CEO who was a 72-year-old former medical director who had retired from the company in 2019 and who agreed to serve for 8 months to stabilize the organization. I was in my windowless room on the 9th floor, teaching the cohort on the difference between correct coding and documentation enrichment, when the interim CEO sent an all-staff email describing the federal investigation as an unfortunate regulatory matter and assuring the workforce that the company was cooperating fully. I finished my session. I drove to Cedar Point. My mother said, "Hello, Helen." I sat with her. I read the weather section. Over the following 3 months, the settlement was negotiated. Marshall and Vivian and the Heartland legal team and the Velvin Atlas legal team met in conference rooms in Washington and in New York. I was not in those rooms. On a Thursday morning in November of 2025, DOJ announced the resolution. Heartland Integrated Health Plans entered into a $556 million False Claims Act settlement without admission of liability, with a corporate integrity agreement running 5 years under HHS-OIG oversight. Velvin Atlas Healthcare Advisory entered into a separate $47 million False Claims Act settlement without admission of liability, and its chart review partnership contracts with 7 other regional Medicare Advantage insurers were terminated under the pressure of the corporate integrity agreement at Heartland and the ongoing HHS-OIG inquiry. Reed Halverson's American Board of Coding credential was suspended by the board, with his name added to the public directory under the notation, "Credential suspended pending regulatory review." He was not indicted criminally. The federal government determined that while his fingerprints were on the methodology at the directorial level, direct evidence of wire fraud intent at the individual level could not be proven beyond a reasonable doubt. He was, as a practical matter, removed from the compliance and coding industry. Joe McAllister was added to the HHS-OIG exclusion list for a period of 8 years, meaning she cannot work in any organization that receives federal healthcare funds. She left Velvin Atlas the week of the settlement and was not available for comment in any of the industry press coverage. Velvin Atlas Healthcare Advisory as a firm survived, with significant reduction in workforce and a new managing partner, but it is no longer a chart review partnership vendor to any Medicare Advantage insurer in the United States. The 407 patients whose charts I had documented as having fabricated HCC codes received letters from CMS notifying them that their charts had been corrected, that the fraudulent diagnoses had been removed, and that no action on their part was required. One of those letters went to Cedar Point Senior Living, addressed to my mother. I held it for a long time before I took it to her room. I read it aloud to her. She nodded. She said, "That's good, dear," which is what she said now when she did not fully understand something, but wanted to be encouraging. I folded the letter and put it in her bedside drawer. I do not know if she will ever open it. My share of the combined settlement, as relator under the False Claims Act, was calculated at 17% of the combined recovery of $603 million, or approximately $102,510,000 gross. After Marshall Elkhorn's firm's share under our retainer agreement, after federal and state taxes, after the qui tam-related withholdings, my net share came to approximately $55,294,000. The check, when it cleared, was deposited in an account at a local bank on Cedar Road in Cleveland Heights, the same bank where I had kept my household account for 23 years. I did not move the money. I did not buy anything. I did not make any calls. I drove to Willoughby, where Heartland's auxiliary office park was located, because my HR email, the automated one, had told me my final separation paperwork had been processed and my employer access was formally terminated. I parked outside the Willoughby building on a Tuesday evening at 7:12 in the evening. The building was dark except for one stairwell light on the 3rd floor. On the passenger seat of my Camry was a sealed envelope from Marshall Elkhorn's law firm with the final distribution statement. I sat there. I thought about 407 patients. I thought about my mother. I thought about my father and the candle on the kitchen shelf. I did not cry. I said one line out loud, to the empty car because I thought I should hear it said. 400. My mother is one of them. I was the one who counted. Then I did what I do every Tuesday evening, which was drive to Cedar Point Senior Living in Strongsville. When I arrived, my mother was sitting in the small reading room at the end of the corridor, where she liked to sit after dinner. A knitted Afghan was across her lap. A cup of lukewarm tea was on the small round table beside her. The light was the soft yellow light of a 40-watt bulb in an overhead fixture. She looked up when I came in. She smiled. She said, "Hello, Helen." I kissed the top of her head. I sat down in the chair next to hers. I opened the plain dealer I had brought with me. I turned to the weather section because my mother had always liked the weather section. I began to read. I read her the 7-day forecast. I read her the piece on below-average temperatures in the Great Lakes region. I read her the small item about early snow in the Upper Peninsula. She listened. She nodded at the parts where a person would nod. When I was done with the weather, I turned to the cooking section and I read her the recipes. We did not talk about what I had done. She did not know what I had done. She will never know what I did. My father knew. He died 15 years before this happened. He would have known if he had lived. He was the one who taught me how to read a chart. He was the one who said the chart is the patient's biography and that you guard it. He was right. He was only wrong about one thing. He did not say that sometimes the biography you guard is your mother's own, and that by the time you have guarded it, she will not know you were the one who did it. I turned the page to the cooking section. I read her a recipe for rosemary braised lamb shanks. She said the rosemary sounded nice. I kept reading. The room was warm. The light was yellow. The Afghan was across her lap. Outside the window, the first snow of the season had begun to fall. I read until she fell asleep. Then I closed the paper, folded it, and set it on the table. I walked down the corridor, through the dining hall, past the front desk where a kind young woman named Teresa said goodnight to me, out the front doors into the parking lot, and to my car. I sat for a moment with my hand on the key before turning it. I thought about what my father had said one last time. The chart is the patient's biography. Guard it. I turned the key. The engine started. The heater came on. I drove home. I am telling you this story not because of the money, and not because I want you to feel any particular way about me. I am telling it because the people who ran this scheme counted on nobody being able to read what they were doing, and nobody being able to prove it, and nobody being able to sit at a kitchen table for 18 months with a blue composition notebook and the discipline of a hospice physician's daughter. They counted on nobody staying quiet for 22 months under seal. They counted on nobody being able to both hold a job in a training room on the 9th floor and assemble a 407-case database on weekends without telling a single coworker. They counted on the isolation. They counted on the exhaustion. They counted on the fact that most whistleblowers break or leak or speak to the press early or hire the wrong attorney or stop cashing the bonus checks in a visible way that triggers an HR review. They counted on me breaking. I did not break. I was my father's daughter. He spent 31 years in hospice medicine not breaking. He taught me how. I am 60 years old now. My share is in a savings account. I have spent a small amount of it. I bought my mother a new bed at Cedar Point because her old one was uncomfortable. I paid off the mortgage on the house on Lee Road. I have set up a modest scholarship in my father's name at the School of Allied Health at Cleveland State University for nursing students who intend to go into hospice work. The scholarship is $5,000 a year, renewable for 4 years, to 1 student per cohort. The remainder of the money is in the bank. I will probably give most of it away. I have not decided the exact distribution yet. I do not feel any urgency about it. Reed Halverson sold his house in Shaker Heights in the spring of 2026. He and his wife moved to a smaller property in Columbus. He took a consulting role at a boutique firm that does not do any federal healthcare work. His name no longer appears on any American Board of Coding public directory, except under the suspension notation. I do not wish him ill. I wish him to not do this again. I think about him occasionally when I drive past his former office building. I do not think about him when I am sitting with my mother. Joe McAllister, as I said, disappeared from the industry. I do not know where she lives now. I do not care. Brittany Lonergan and Ian Peregrine Moss, the two analysts whose names appeared on most of the fabricated codes, both received federal declinations of prosecution because the evidence showed they had been following the methodology handed down from Halverson and the Velvin Atlas partnership, and because the federal government made a judgment that prosecuting the foot soldiers would not deter the scheme at its source. They both left Heartland. Brittany works in HR software now. Ian moved to Oregon. I do not think about them at all. My mother died in January of 2026, 3 months after the settlement was announced, at Cedar Point Senior Living, in her sleep, of complications that were not congestive heart failure. The last time I sat with her, the night before she died, I read her the weather section of the Plain Dealer. There was going to be a cold front. She closed her eyes while I was reading and said, "That's good, dear," and then she slept. Her actual cause of death, properly coded, was natural decline associated with advanced vascular dementia and age-related general weakness, and there was no congestive heart failure on the final discharge summary. I insisted on that, quietly, with the hospice physician who attended her, and he agreed with no objection because there was never any clinical basis for the diagnosis. Her chart is now correct. Her biography is now correct. My father would have approved. He was only ever strict about one thing, and this was the thing. Guard the chart. I have one last thing to tell you before this is done. In the weeks after I received the distribution, I took the manila envelope from the second drawer of my kitchen, the one with the 16 uncashed Heartland bonus checks, signed and endorsed but not deposited, totaling $31,400. I took it to Marshal Elkhorn's office. I told him what it was. He looked at the checks. He looked at me. He asked what I wanted to do with them. I told him I did not know. He thought for a long moment, and then he said, "Doreen, these are yours. You earned them during a period when you were both doing your job honestly and collecting evidence against a scheme you were not responsible for. You did not take the money because you did not know what to do with it, but the money is legitimately yours. It is not tainted." I thought about that. I thanked him. I drove home. I sat at the kitchen table with the envelope for a long time. Then, I took it to my local bank on Cedar Road, and I deposited all 16 checks, which had by now been stale-dated for some of them and required bank processing to clear. And once they cleared, I wrote a single check for $31,400 payable to the nursing school at Cleveland State University to add to the scholarship endowment in my father's name. It is a small amount relative to the overall settlement. It is a specific amount, and it matters to me. My father would have understood. He used to say that money has a biography the way a patient does, and that you guard that too, which meant, in his usage, that you decided what the money had been for before you spent it. Those checks had been for the 407 patients whose charts were wrong. Now they are for the next generation of hospice nurses. That seemed right. I drove home. It was a Tuesday. It was snowing. That is the story. My name is Doreen Walsh. I am 60 years old. I spent 22 years reading medical charts for a living, and one weeknight in January of 2024, I found my mother's name on a falsified diagnosis, and I did what my father had taught me to do. I counted. I was quiet. I guarded the biography. I handed the evidence to a federal attorney. I waited 22 months. I went to work every day. I read the weather to my mother on Saturday mornings. I did not break. And when it was finished, I drove to an empty parking lot in Willoughby at 7:12 in the evening on a November Tuesday, and I sat there with a sealed envelope on the passenger seat, and I said out loud the only thing that needed to be said. 400. My mother is one of them. I was the one who counted. Then I drove to Cedar Point. Then I read her the weather. Then I drove home. That is all.